Okay, so now we're going to go over Gow-Gates mandibular nerve block. So this is known as the true mandibular block. And this is almost all of V3, which is the inferior alveolar, mental, incisive, lingual mylohyoid, buccal, and auriculotemporal. And it's known for quadrant dentistry, but it is unsuccessful. It's very hard to do. So the target is the anterior-medial border neck of the condyle. And you want to make this line, this imaginary line from the notch of the tragus to the commissure, so right here to the labial commissure, and you want to go in parallel to that line. And the injection site is distal to the height of the mesiolingual cusp of the maxillary second molar, following the extraoral landmark that we just made. The needle is placed inferior to the mesiolingual cusp of the second molar. The barrel of the needle is over the contralateral mandibular canine or premolar. Now, complications and symptoms of Gow-Gates, there's numbness of the interior 2/3 of the tongue, floor of the mouth, body of the mandible, inferior ramus, skin over the zygoma, posterior cheek, temporal regions, and the lower lip. It takes longer for onset and it lasts a lot longer. And there can be problems if the patient has limited opening. They can't open their mouth very wide. All right, now we're going to go over local anesthesia. So the uses of local anesthesia is for pain management and hemostasis. This is so accurate anesthesia without risk of cross-contamination or intravascular injections is important. And these are the supplies or parts of the that you use for anesthesia. You use a syringe, a needle, and a cartridge. A syringe is a metallic. You have 3 different types: a metallic cartridge aspirating, plastic reusable aspirating, and plastic disposable. Metallic is the most satisfactory and most widely used for intraoral anesthesia because it allows the practitioner to check for advertent intravascular injections. And that reason is because you can easily pull back. And we have a plunger and harpoon and a thumb ring. Aspiration, so there's a plunger that engages the rubber stopper with the harpoon. This allows the clinician to pull back, creating negative pressure, and incidence of positive is as high as 10 to 15% in some techniques, so it's very important for you to aspirate. Needles, there's different types, there's different characteristics, so it's disposable. You can only use 1 needle per patient. Don't be reusing needles. We don't want cross-contamination. We don't want an infection to occur. It's stainless steel, so it's very strong and it's very flexible. And that bevel point, which is right here, it's very thin, so it gives efficient puncture and gives very minimal trauma to the patient. So needles are characterized by their length and gauge. So length can be long, short, and ultra short. So long is this much, short, ultra short. Gauge is the diameter of the lumen. So the common gauges that we use is 25, 27, and 30. But the gauges are inverted, so 27 is long, 30 is short. Advantages for using a large gauge is that you'll have less deflection, so you have greater accuracy. It's easier and more accurate for the aspiration of blood. It's preferred gauge for high-risk injections such as PSA, IA, and IO. Types of injection, you have local infiltration, nerve block, and these will determine type of needle used. For local infiltration, this is for a small area, like 1 to 2 teeth and associated tissues. Injection is deposited to the tissue near the apices and the trigeminal nerve endings, and it has variable success because it depends on the anatomy of the patient. The nerve block anesthetizes a large area, like the IA block, which is the most common. The injection deposited near large nerve trunks, and it blocks the main nerve branch. It has greater success than infiltration. Adverse reactions, so local adverse effects can occur with the administration of local anesthesia. Common causes of physical injury by using the wrong technique, or administration by using too much volume or pushing it in too fast. So basically, whenever you get anesthesia, I don't know if you guys have ever noticed, but whenever they inject it very slowly, because if you put too much in at the same time, too quickly, it might not be accepted by the tissue. The length of the needle, so long needles are used for major nerve blocks like IA, maxillary, and IO. Short needles are injections that don't need significant penetration like PSA, MSA, long buccal, and mental block. Cartridges are also called carpals. It's single dose and it's disposable. It's sterile and pure, and it permits observation of aspirated blood. So you look in here, see it's glass, so you can see if there's anything wrong with what's in this, the fluid. So you need to inspect it before you give it to the patient. So you want to make sure that you have the right anesthetic and vasoconstrictor. You gotta check the expiration date. You gotta make sure there isn't any cracks or chips. If there's large bubbles, that may indicate freezing, and you don't want any altered appearance like cloudiness. And then all the anesthesia cartridges have color codes, so you know what product is actually in it, and it says it right here as well. So the sequence for syringe assembly, she goes over this in her videos, so you guys can watch that as well. But the main thing is with this assembly, which is the most common, is this part right here goes into here. And the reason that we put this part on last is to make sure that you don't bend that needle. Because if you put this in after, you can bend that needle, which is another way that people put the syringe in. But this way is the most common and to not cause problems. Topical anesthetics. This penetrates the mucous membranes from 2 to 3 millimeters. It allows for painless needle penetration. It has a higher concentration than injectable counterpart, but it does have greater potential for toxicity locally and systematically. They lack vasoconstrictors, vasodilators, and they have rapid absorption. Safety and handling. You do not recap needles with 2 hands. You use the one-handed scoop technique because you don't want to nick yourself. We have needle holders, and we have that red sharps container as well. Treatment record. You want to make sure you put the date, the amount that was administered, what type of concentration and vasoconstrictor, what type of anesthetic, the type of injection, what reactions the patient had, and who administered that anesthetic. And this is what it looks like right here, like an example. And these are examples of cartridges. Notice how it's color-coded. It tells you everything that you need to know on here. And then this is the math. She says she's not going to ask us about this, but you might be asked to do math. Like if you work for a certain dentist, he might want you to calculate this. I don't know what this means, so I'm not going to teach it. So we're going to skip this part. Auric kits. You guys remember when we first got our kits and we went through it and they took this from us? So this was in our kits. It was taken from us, but this is a topical gel. It has 2.5% lidocaine and 2.5% prilocaine. It's very site position, has a 20-minute duration, and it's effective in 30 seconds. However, you can only use 5 cartridges per visit. And that is it for this one.